I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also diplomat of the American Association of Integrative Medicine. I'm the author of this book, Growing Young. I own a private practice in Mounds View, Minnesota called Mounds View Chiropractic. In my office, we specialize and focus on working with patients who suffer from chronic neurologic disorders. Today, what I'm here to talk about is autism spectrum disorders. Disorders such as autism, Asperger's, ADD, ADHD, dyslexia. Now, if you're watching this video, chances are that you either have a child or know a family that has a child that's suffering from one of these autism spectrum disorders. Autism, ADHD, ADD, dyslexia can be very frustrating for the child. They can be very, very frustrating for the parent as well. And they can be very, very frustrating for the school that's trying to help them along. And so it is a condition that's characterized by a lot of frustration for an entire family, really. And so in our office, we really enjoy working with these patients and trying to help normalize not only the child's life, but the life of their family as well. Now, in order to begin to understand how we work to support patients that have ADHD or ADD or autism, you have to look at what the brain does. And basically what we find with children that have these neuro-developmental disorders is that there's an imbalance in certain areas of the brain that are affecting the way the brain communicates back and forth. And so you have to look at the brain in two halves. Basically you have the right hemisphere and the left hemisphere of the brain. And so conditions like autism, ADHD, ADD, Asperger's, these are all going to be right brain deficits the majority of the time. Okay, so we're going to have delays in the right brain. Whereas with dyslexia, it's going to be tend to be the opposite. It's going to be a left brain delay. Now, what does that mean? Well, the right hemisphere is the brake pedal of the body. So it's what helps us slow down. It's what helps us control emotions. It's what helps us focus, not react to impulses. It's the area that's the creative area of the brain. Okay, the left hemisphere, on the other hand, likes routine. Okay, it's stimulated by routine behaviors. It's the the gas pedal of the body. So it's kind of the go, go, go area. And so what happens is if you have a child that has a right brain weakness, and there's an imbalance in the way the left and the right brain is balancing, you've lost your brake pedal. And so this is why typically with kids that have autism, ADHD, ADD, many times they're going to be kind of in that hyperactive stage where it's kind of a go, go, go. They want a lot of stimulation and they're moving a lot. They also tend to be the ones that have a very hard time controlling emotions. So you see large personality swings where they're extremely happy, or on the other hand, they get very, very angry very, very quickly. Okay, and so this is very characteristic of a child with a right brain disorder. On the other side, the left brain individuals, children with dyslexia, they're going to have more problems with the analytical side of things. Okay, they may have a hard time with math and with reading, okay, with language, because that left brain is very, very important in that area. They tend to do very, very well with interpersonal relationships. So socially they do very well, but maybe not so well in the classroom. Again, with the right brain deficit, many times we'll see that they have a harder time interacting appropriately with peers as well. And so in order to get to the bottom of how we work with these patients, the bottom line is what we want to do is we want to support whatever the deficit is. And so in each individual that comes into our office, we're going to do a neurologic exam where we look at how the brain is working and we find the areas of deficit. So we perform a neurologic exam that's very, very comfortable for the patient. The children do great, and it allows us to identify what areas of deficit there is. Is there a right frontal lobe deficiency, a left parietal lobe deficiency? But once we find that area of weakness, we develop therapies that are specific to that area. The problem with conventional management that I see in my office is, for instance, if you take Ritalin or Adderall or any of these medications, for example, they're going to boost levels of brain activity. The problem is that they're just boosting overall brain activity. So if you have this imbalance in the brain where the right brain is performing down here and the left brain is performing up here, and you boost that all up, there's still a disconnection where the brain is not able to communicate back and forth between those hemispheres. So you're still going to see some neurologic compromise. What we want to do is we want to leave that dominant left brain alone and help to boost up the right brain and bring balance back to the system so the child's brain can interact as is appropriate. Now, how do we do this? Well, like I said, the very first thing is we have to do the neurologic exam and find the exact areas of deficit for each child. Once we've found that, then we develop a treatment plan or a support plan for that patient to support those areas of the brain that are weakened. In addition to that, with the neurologic exam, it's very important that we search for primitive reflexes. Primitive reflexes are reflexes that develop right away after birth, and they should be gone by a year of age. What we find is that in children with any of these neurodevelopmental disorders, typically you're going to find prolonged primitive reflexes. These primitive reflexes lay the foundation for the normal development of the brain. You have to get rid of these reflexes so you can start building the brain back up. Now, how is this affecting your child? You know, what are your goals for your child? Is your child just simply having a hard time in school because of a lack of focus? Is your child nonverbal? Okay. Each parent that comes into our office is going to have different goals, and so part of our program is also helping you understand why your child is where they're at and helping you to understand the progression that has to take place in getting this child to make progress. Take, for instance, in a child, you may say, well, you said, you know, verbal communication is a left brain feature, but you're telling me that my child has a right brain delay. Why is this the case? Well, the reason this can be the case is because the right brain is responsible for nonverbal communication. And so if you don't develop appropriate nonverbal communication, you're going to see problems developing verbal communication as well. And so you can see that even though you may have a significant right brain deficit, it is going to impact certain areas of development on the left side as well. And so it can be very confusing for the parent, but that's where we're here to help you sort that out and to be able to support your child in an effective manner that's going to bring balance back to the neurologic system. The second piece of the puzzle, and an equally important piece for these children, is to evaluate them metabolically. We have to look at what is driving this. Why are they developing this neurodevelopmental disorder? You know, if we work and try to support the child and bring the brain back to health, but they have an autoimmune process, for instance, that's what is actually driving this condition, even if we're successful for bringing that back, their immune system could continue to cause an issue that continues to relapse and reoccur. And so we have to look at the underlying causative factor of why they have developed this neurodevelopmental disorder in the first place. And so how do we do that? Well, the very first thing we want to do is we want to do some metabolic testing. We want to look at the child's blood sugar. We have to look for signs of anemia. We have to look at fatty acid metabolism. These are just basic things that if your child has a deficit, if they're anemic, they can't get oxygen in their cell. The brain is responsible for using about a third of that oxygen. So the brain is going to suffer if the child is anemic. Same thing with blood sugar. If your child's blood sugar is not tightly managed, it's going to create significant problems for the brain and for the child overall. We have to look at sensitivity testing. What we find is that many of these children have poor gut function. The reason the gut is so important is that 70% of the immune system is in the gut. And so if your child has foods that are causing reactions within the digestive system, this is going to flare up the immune system and cause inflammation throughout the body, including in the brain. So this is one very, very common causative factor that we see driving these processes. We have to look at food sensitivities. The most common food sensitivities we need to look at are gluten, dairy, soy, yeast, egg. We have to identify if there's any of these foods, because if your child is eating these foods routinely, you're never going to see your child progress and get to the point you want them unless we identify specifically which foods are reactive. Next, we also have to look for underlying infections in the gut. Okay, again, the gut is very important. Now, your child may not complain of any digestive complaints, and that can still be where his or her primary problems are coming from. And so when we look for infections, we're looking in the gut to find out if they have any parasites, bacterial infections, fungal or yeast overgrowths in the digestive system that are, again, perpetuating a chronic inflammatory response that's going to create inflammation in the brain as well. These are just a few of the lab tests that really need to be ran. But you can see we have to dig deeper than traditionally what's been done to find you the answers as far as what's going on the neurologic side for your child, but also on the metabolic side. When we get this big picture and bring it all together, we're able to support your child in a manner that gives them the best chance at really recovering from this neurodevelopmental delay. Now what I want you to do is take just a few minutes and consider what your hopes for your children are. Is it that you want your child to be able to graduate from high school? Is it that you want them to be able to go to college? Do you just want them to be able to speak again? You know, whatever your hopes are, if hopes are for your child, if they're not currently being met, if your goals are not being met with the traditional treatment that you're applying, then you need to make a change. Insanity is doing the same thing over and over again, expecting a different result. That's what we offer here, is we offer a different approach that offers you, I think, a better chance at seeing significant change in your child. So please explore our website, register to come into our office where we can better support you, get you answers as far as what we can do for your child or for yourself, and hopefully get this moving in the direction that you would like to see it. I thank you so much for taking the time to watch this video, and again, we look forward to seeing you in the office. God bless.